If you think your hip flexors are causing you some hip pain, or you are a health professional who helps other people with their hip problems and are wondering how you can think about the hip flexors and how you can help people with their hip flexors, then this video is going to help you. Hey everybody, it's Matt Shu from Upright Health, where we help you move beyond your limitations so you can live with confidence. In this video, you are going to be getting access to a segment from the Healthy Hips workshop. We actually recorded this live during one of our Healthy Hips workshops. It's Trevor, the tallest member of the Upright Health family to date, teaching you and everybody who was present at the workshop about the hip flexors and what you can do to improve your hip extension ability by dealing with your hip flexor stiffness. He's also going to show you a big test that you may have seen before, but he's going to break it down for you in a way that makes it real understandable, real easy to use to help either you or somebody you're working with improve their overall hip health. So get your pen, get your notebook, get your brain turned on, and get ready to learn about your hip flexors from Trevor.
Well, we've talked a good amount about hip extension. This actually tails off of what Vincent had us work on. So hip extension is the ability to get your hip all the way into at least 180 degrees or 0 degrees. You said you had negative 5. We've seen a lot worse. So -5 isn't actually that bad, but ideally we'd be able to get at least some degree of actual hip extension. What we see a lot of the time when people don't have hip extension, or one of the patterns where we see that most commonly people lack hip extension, is that overextended lower back position. And so people end up hanging out with their pelvis tilted forward. And what that means is if I were to actually straighten out my lumbar, we were talking about this earlier, if I were to straighten out my lumbar, I'd actually be standing like this all day. You're at, what, maybe 20 degrees hip flexion already. So that's where we commonly see people stand in hip flexion all day and then lack hip extension. The ways we work on it are fairly simple. And actually, Vincent already showed us how we would go about activating the opposite muscles. And so that would be some sort of bridging motion. We could do kickbacks of some sort where we're working in hip extension this way while maintaining some actual core activation. So that's how you would go about actually training hip extension. What I want to talk about a little more is if you're limited in hip extension, how we would go about gaining it back. We already talked about one, the wall quad stretch. So there's different muscles that could be the problem here. So you have your rectus femoris, which actually crosses the knee and the hip. You have your TFL and your sartorius, which also play a role in the knee and the hip. Then you have your psoas and your iliacus, and those are deep. And they only cross the hip. You're gonna sit on the edge like this, and lean back. Get as close as you can to the edge there. Let's bring both knees up to the chest. There we go. Yeah, we're bringing the knees close to the chest so that we're locking her hips into posterior tilt. Then what we're gonna do is allow her to drop one leg to the ground. I can do this myself, or she can grab onto this knee. But what you can see is her foot wants to float away, and her knee is close to, but not quite to, that 180 degree angle we want. This can tell us two things. If we have someone who, I'm gonna relax you a little bit. If we have someone whose foot comes really close and they can pull this really far back, but they can't get their knee down, we're probably looking at psoas, iliacus, those deep muscles. If we see someone who has what she's kind of working with here with the foot that goes way out in front, probably dealing with some of the muscles that actually cross at the knee. So rectus femoris, TFL, sartorius. And then also, she doesn't have any bias either way. A lot of times you may see someone bias into external rotation or internal rotation. The muscles really don't matter. We can name them, that's great, but really positionally is all we're really thinking about. So for her, I would have her work on her quad a lot. So anything with a bent knee and hip extension. So it could be just a conventional quad stretch.
All right, guys, I hope you have found that useful so far. If you want to see the rest of that portion of the course, you can go to our website and sign up for a free preview of the Healthy Hips workshop. It's an online preview that is going to give you access to the rest of this segment on the hip flexors as taught by Trevor. It's also going to give you access to a full segment from Vincent where he's teaching you the importance of abdominal engagement and shows you strategies for increasing your pelvic control by using your abs to help you with your hips. And plus, you're also going to see some video of me teaching different parts of the course, so you'll be able to get different perspectives and really crucial information that's going to help you improve your hip health, improve everything about the way you train your body. So head to the website, check it out, and as always, I hope you remember that pain sucks, life shouldn't. Hey, while you're at our website, don't forget to check out our events page for upcoming workshops so you can learn with us live.